One of the things that the Accuro is very specific and great for is teaching, okay? Residents, when you are first learning to do an epidural, it is very difficult. The things that it can help you identify, number one, immediately identify the midline, and then see how deep and where you need to go, the angle you need to go. So as far as a teaching presentation. Now, one of the things that people don't realize when I use it are very, very thin patients. These patients may have very narrow inner space, and you don't know how deep that ligamentum flavum, and you don't know how deep the dura is, and you can easily go too far. So I will use it in addition on those very, very thin patients that you may think are not a challenge, but you want to know how deep the dura is so you don't get a wet tap. Presently, the Accuro is a part of my practice, which I cannot be without. And I see the evolution of people using and depending on the Accuro for those patients to help you, the value to help you with getting an epidural in efficiently and safely, time and time again. And where this technology will lead is to the next generation that we're already seeing is live needle visualization, which is very exciting as well. So this is part of the practice, many of our practices, and it's going to continue to be part of a practice, and it's going to evolve to be even a bigger part of the practice in the future.